Holmium laser enucleation of the prostate. This is part of a series of short videos to explain what an enlarged prostate, otherwise known as benign prostatic enlargement or BPE, is. This video highlights one of the surgical procedures, called holmium laser enucleation of the prostate, or HoLEP, that may be suitable for you. HoLEP is usually carried out under general anaesthetic, meaning you will be asleep during it. It can also be done using a spinal anaesthetic, meaning you'll be awake and numb from the waist down. The procedure takes between 1 to 2 hours depending on the size of your prostate, and patients normally stay in hospital for 1 to 2 nights afterwards. Some hospitals may do this as a day case, meaning you will go home on the same day, with a catheter to be removed later. A scope, or thin tube, is inserted into the urethra. It has a camera which allows the surgeon to view the prostate and see where cuts need to be made during the surgery. A laser is inserted through the scope, which is used to remove the enlarged prostate tissue and to seal any blood vessels. The removed tissue is then pushed into the bladder. The laser is taken out and another instrument, called a morcellator, is inserted through the scope. This is used to remove the tissue from the bladder, which can then be sent to the lab to check for anything abnormal. The scope is removed and a catheter is put in place. Most patients have this removed the morning after surgery, but some may need to go home with it and have it removed at a later date. Some bleeding after the procedure is common. Urine will usually be clear of blood 24 hours after the procedure, but some blood may be seen for up to 6 weeks. At first, it may be painful to pass urine, and you may need to go more often than normal, but this usually settles within a few days. Some patients may find they leak a small amount of urine, particularly on coughing or lifting. This usually resolves within a few weeks or months. After the procedure, it is common to feel tired for 1 to 2 weeks, and you should avoid heavy lifting or straining. For most patients, it may take a few months for symptoms to improve. The long-term benefits of HoLEP include symptom relief and improved urinary flow, no need for medication for enlarged prostate, and improved quality of life. Before the procedure, your clinician will talk to you about possible side effects. These include mild burning sensation when passing urine, increased frequency or urge to pass urine, blood in urine, urinary incontinence, which may be improved with pelvic floor exercises. Most side effects resolve within 6 weeks. With HoLEP, about 90% of patients will lose the ability to ejaculate semen. This is known as retrograde or dry ejaculation. It means semen is not ejaculated through the penis, but travels back into the bladder. It is not harmful, and sexual climax sensation remains, but it may feel different. Less than 1 in 10 patients having this procedure will suffer some deterioration in erectile function. This can be temporary or permanent, and medication can be prescribed to help reduce the issue. Your urology surgeon will discuss possible treatment options, including side effects, with you, based on your own personal circumstances. More information is available online, such as these websites. Please discuss any concerns you may have about your symptoms and treatment options with your doctor.